one of them is confined to a wheelchair, or one of them has had a FRAT assessment, where they've had 2 falls in the last 2 years, or then you immediately step into the zone of a different type of service provision and therefore training.
I think that's a good point, because just talking on with previous doing my previous interviews, a lead nurse in Sunbeam that is over the medication has suggested that he's putting the emphasis of specific trainings within staff in areas of dementia, for example, as it seems that over 50% people in disability develops really early stages of dementia as well. So he was referring that he sees that as a good starting point of early supporting that process of aging from really beginning stages. So I mean, that's a good point to
super.
So,
and I think it kind of ties in with the next one, like the recommendations that I'd be talking about would be training, identifying changing needs, assessing people's needs at a regular basis and reassessing them, and most importantly, I think a clear, coherent strategy.
Yes. I think.
Is that okay?
That's that's fine. I just, if you have time, I just doing the external interviews. One of other managers was a little bit against having too much of framework, so he was afraid of almost placing or categorizing our clients into different places because of their age or their needs. That was kind of his take on why he was against putting people in categories, so-called.
Yeah, I mean, you can do these things respectfully as well. Remember, I mean, data is power. You need analysis. You need to know who you're serving, right? You don't have to, so let's say, if it does mean, let's say on an Excel spreadsheet you are putting people into boxes, you don't have to, in a disrespectful way, find, this home suits you. But what you need to know is what the challenges are, because if you don't, I think I can't emphasize enough about how you need to know who your clients are and what the challenges are now and in 5 years' time. Otherwise, you're always going to be chasing. So every September we bring in a bunch of young people into it. Their needs are very, very different, and obviously you're always going to have specialist supports for them. But all the way along, people are shifting. When I joined the company first, people I was working on a daily basis, they're all getting old now. But they were the young ones, and some of them, and I think you need to also, we're going to have a big issue around health issues and physio and that type of thing because of the last. It's going to be 18 months of the pandemic, and it's going to have a big impact on physical needs of people. So that's really, really important that we understand that.
Go on. That's
all right.
That's
so
brilliant.
We can get off the N11 now.